Friends from the media, good morning. Welcome to the press briefing. The Chief Executive will first speak before answering questions. Because of the pandemic, please keep your social distance and keep your masks on. We'll first hear from the Chief Executive. Friends from the media, people of Hong Kong, good morning. Today is the 4th of January. It's the first time I meet with the media in this year, so I take this opportunity to wish you all a healthy and prosperous new year. To the general public, we all hope that we will be able to conquer the pandemic so that our lives can go back to normal. Another important milestone to mark the start of the new year is the commencement of the 7th term of the LegCo. Oaths have been taken yesterday and I administered them. I confirm that the oaths taken are valid. So the 7th term of LegCo will go into operation. And the LegCo, I believe, will work very well with the government. There are a number of important legislations that have come into effect with the new year. One of them is the tenancy control in relation to subdivided flats. So this is consolidated tenants and landlord consolidated ordinance will commence on the 12th of January. The government has published a press release to explain about the ordinance. And advice will be given by prospective landlords and tenants of subdivided flats by departments. The other one is in relation to alignment of statutory holidays with labor holidays. The labor sector has been asking for this, and it will be put in place in phases. So, for the first time, laborers will enjoy the Buddhist birthday on the 8th of May. And I am also happy to see that from the 1st of January, primary and secondary schools will implement a flag raising ceremony as per another piece of legislation. This will enhance their identity with our motherland. I have previously said that dozens of legislative proposals will be introduced to the new term of LegCo for their consideration. I would like to speak on two things today. Both of them are related to the pandemic. First, the development of Omicron in Hong Kong. The second thing is something that has been brewing in our community, that is the to be introduced vaccine bubble. First, because of Omicron, a variant of the virus, the pandemic in the world has made a turn for the worst. There has been over 1 million infections a day, even close to 2 million per day. Most of them are from the US and Europe. Because of, there are also flights flying between Hong Kong and these places. As a result, the number of cases has been increasing for the past 4 weeks. We hear that every day the number of imported cases has been increasing rapidly. Say between the 7th and 13th of December, 24 imported cases, and then we have 43 cases, 65 cases, and 123 cases for the subsequent weeks. So for confirmed cases, whether it's symptomatic or not, the patients will be sent to the hospital for isolation treatment. This in turn has brought huge pressure to the hospital authority. Today we have over 230 patients admitted. With the consent of the steering committee chaired by me, the hospital authority recommends the operation of the Asia World Expo community community treatment facility. We will keep a close eye on the admission of patients to see how we will react. As yesterday, we have identified, in terms of Omicron cases, 102. 97 of them are imported cases. The remaining 5 are related to imported cases epidemiologically. It's lucky that so far we have not yet seen in our community unlinked cases. Of these cases, over 60%, that is 62 cases, are asymptomatic when diagnosed. According to local experts, the characteristics of Omicron cases is that most patients contract the virus and manifest no symptoms, but at the same time they are spreading the virus. So it is more difficult for us to detect and react, and we have to do our best to try to stop any transmission of Omicron cases. We have Moon Place cluster. This is a restaurant. When the Hong Kong SAR government adopts zero local infection cases, it doesn't mean that we will have absolutely zero cases. It's a dynamic zero. As long as there are active and effective measures in place, we will stop effectively the transmission of cases and stop any possible transmission chains as a result of these confirmed cases. So regarding Moon Place clusters, this is a good example. A Moon Palace cluster, you can see that we are very effective, but we still have to wait and see if we successfully cut the transmission, because it's less than 10 days since that meal at 27th of December. But we have implemented this dynamic zero infection cases. And on the 8th of December, we identified that there was an imported case who visited the Moon Palace. We immediately invoked 599J. We call it CTN. It's a compulsory testing for certain persons under the Prevention and Control of Disease Ordinance. So for those patrons who visited Moon Palace between 1 o'clock and 3 o'clock in the afternoon on the 27th of December, they have to be tested. When the Center for Health Protection was made aware of a second case, that is, the father of the crew member, it was confirmed that there was a transmission in Moon Palace. Immediately, those people who were dining in that period of time, altogether 64 tables amounting to 207 customers and 22 staff members, were all classified as close contacts and sent to Penny's Bay for 21-day quarantine and medical surveillance. At the same time, these close contacts are being tracked. So over 100 people who live with the close contacts are sent to Penny's Bay, and they are subject to 4 days quarantine. In other words, in relation to Moon Palace, over 370 people have been sent to quarantine centers. Well, we are at the same time concerned about environmental infection. So the Center for Health Protection, as well as the EMSD and the FEHD have been to the restaurant and collected 42 environmental samples that they've all turned out to be negative. There are still 6 customers sat at 2 tables that are still unreachable, we will still try to track the 6 customers using the regulation. I make an appeal here that if you are at Moon Palace between 1 and 3 o'clock in the afternoon on the 27th of December, please contact the CHP as soon as possible.
To further curb the transmission of the Omicron variant, we have put in place various measures. The fact is the Omicron variant has entered the Hong Kong community. Experts believe that the next 2 weeks will be critical. If we are able to curb its transmission during this period, we might prevent a 5th wave of outbreak in Hong Kong. In terms of curbing the transmission chain of Omicron and achieving the dynamic goal of 0 infections, a few areas of work need to be done. First, we need to enhance testing. By doing that, we are able to identify confirmed cases and in turn curb the spread of the variant. And we accomplish this task through CTMs. We have issued compulsory testing notices for 30 to 40 places, covering places visited by confirmed cases, and we urge residents living in those areas to get tested. And since there is an incubation period associated with this variant, any members of the public subject to CTNs will have to undergo regular testing. And that is why some people question why they are frequently tested, and the reason is that there's an incubation period to the variant. And over the course of 21 days, they might be tested for up to 7 times. So I'd like to thank the support of the public, and hopefully we will continue to support the testing work, because this is effective in curbing the transmission chain of Omicron. For the places of stay of confirmed cases, we are putting in place restriction testing notices. That is, we put certain places under lockdown, and I visited some of these areas under restriction testing declaration, and we have conducted 4 lockdowns, and 2,447 people were tested, and the results all came back negative. And meanwhile, we must reinforce our testing capacity in light of the workload. And during the holidays, members of the public were very cooperative in undertaking tests, and between the 25th of December to the 2nd of January, at community testing stations and mobile testing stations, more than 400,000 tests were conducted, of which more than 30,000 people received notifications under the Leave Home Safe app. They received push notifications informing them that they visited certain places and they must be tested. This is the first time mass notifications were sent to people subject to testing since the app was launched, and over a very short period, we reinforced testing capacity by introducing mobile testing stations and additional testing capacity at the community testing centers. But due to the large amount of people to be tested, waiting time also went up. So going forward, we might reinforce manpower and provide greater convenience for the public to get tested. So once again, I call upon everyone to stay vigilant. If you are experiencing symptoms, you should seek medical advice and get tested. Even if you don't, but if you are notified by the Leave Home Safe app that you visited certain places frequented by confirmed cases or places subject to CTN, you should also get tested as soon as possible. And we are also working hard to prevent the importation of cases. Recently, we have included more countries and areas as Group A specified places, and we have issued news releases recently including additional places and countries. As of today, 109 countries are listed as Group A specified places. Another 15 places or countries have been listed as Group A places with enhanced surveillance. We have tightened the quarantine arrangements for air crew, cargo crew members in Hong Kong, and the crew members are required to stay in a quarantine hotel for 7 days. We also tightened the suspension mechanism for flights to Hong Kong. And if a certain number of confirmed cases are found on a flight, then that flight route would be suspended. And a number of airlines have seen flights suspended. And even flights visiting the same destinations would be suspended. So basically, no more direct flights are offered between those places. We also tightened the RNA testing arrangement pre-boarding, and it was tightened from 72 hours before boarding to 48 hours. So in light of the Moon Palace cluster, we have implemented a series of measures, but like we said, we will continue to work with experts to decide the next course of action. In terms of the vaccine bubble arrangement, at the end of year review on the 30th of December, looking back at 2021, I said that pandemic control remained a priority. And among the measures was the move to enhance the vaccination rate in Hong Kong to provide a protection barrier. Subsequently, on the 31st of December, the Secretary for Food and Health, Professor Sophia Chan, indicated that we will expand the vaccine bubble requirement to enter a premises or to join a certain activity. Vaccination would be a prerequisite requirement. You must have received 1 or 2 doses of a vaccine. So vaccination will become an entry requirement, say for those who are not fit for vaccination or those who are under the age of 12 or people who can produce medical proof that they are not fit for vaccination. After the news, we saw that more people got vaccinated. So 72.9% of the eligible population have received the first dose of a vaccine. Yesterday, close to 18,000 people received the first dose of the vaccine, which was a recent high. For a very long period, only 1,000 to 2,000 people received the first dose daily. And yesterday, more than 15,000 people received the third dose, which was good to see. In order to for Hong Kong to battle the pandemic and for people's lives to return to normal and to create favorable conditions for border reopening, we must boost our vaccination rate. I now announce that on the 24th of February, that is about 7 weeks from now, the SAR government will implement a series of measures to expand the vaccine bubble requirement. the scope will not be limited to scheduled premises under Cap 599F. We have been discussing these scheduled premises recently, such as restaurants. The vaccine bubble will not only cover 599F scheduled premises, but also other premises not covered by 599F. For example, culture and recreational facilities such as public libraries, museums, under the LCSD, they would be included in the vaccine bubble arrangement, and this also includes schools. Schools would also be put under a vaccine bubble, but whether the requirements would apply to only staff or everyone, we are still ironing out the details. In mid-December or around the 21st of December, the Civil Service Bureau announced that starting from February, everyone entering government premises must be vaccinated, or all civil servants must be vaccinated. But so far, the vaccine bubble requirement does not cover to everyone entering these premises, but whether this is something we will implement going forward, we might have further announcements later. For schools, at the initial phase, the requirement might apply to school staff, teachers, school heads, etc., but not to students. And the vaccination rate among students is not too bad at the moment. We will be discussing the implementation details with stakeholders before we make an announcement. But this is how we can boost vaccination rates in Hong Kong.
Today, on the 4th of January, I announced the implementation of the measure to commence on the 24th of February because we need time to make preparations, especially the catering industry. We can't possibly ask them to make all the required preparations within a very short time because they have to make changes with their facilities. We also have to clarify all technical issues to facilitate premises to verify vaccination records. We leave no stone unturned to find a way to make it easy for premises to check the record of customers. The second reason is that we need to give time for members of the public to get vaccinated. As you saw that the number of people receiving their jabs increased from just several thousand to 18,000 yesterday. We now have achieved a 72.9% vaccination. If we are to increase it by another 10%, we're talking about an additional 600,000 people getting vaccinated. So we need to check that testing centers, mobile testing centers, and relevant vaccination facilities will have the capacity to absorb the increase in demand. We need to make it very clear that in terms of the fight against the epidemic and the boost of vaccination rate, the position of the government, well, we need to dispel all rumors flying on the internet. And if we identified any malicious ones, we will lose no time to clarify. So that's why I took this opportunity to make the announcement. I ask you all to give us time so that the Food and Health Bureau can clearly set out the application of the rules to premises, especially scheduled premises, and we also need time to communicate with the catering sector in relation to checking of vaccination records. In the coming few weeks, we will move at full steam in these areas. I'll now take questions. Please raise your hand when your name Identify your organization and use the microphone we give you. The lady reported at the back. I'm from Now TV. First, in relation to the vaccine bubble, you said it would include a certain leisure and recreational venues. So is it the case that they will all be included on the 24th of February? What about shopping malls, offices, some private places? Would they be included in any of these vaccine bubbles? Secondly, because of the worsening infection situation, any plans for the government to suspend classes or tighten the relevant measures? Is there a timetable? What will it take for the measures to be tightened or for work to suspend? In relation to the staff members of Cathay that breached the rules, will you pursue them for the liabilities? For Citizens News and Stand News, how do you assess the current freedom of the press? There are certain organizations said that they're affected by what happened to Stand News and they can't feel safe. How do you ensure that reporters will still enjoy freedom of the press? You have asked a number of questions in relation to the pandemic. First, to make use of vaccine bubbles to boost the vaccination rate will have to be proceeded with caution and care. It can't be done overnight. As I've said previously, before today, we have made announcements that it will apply to those who work in government premises, and it will also apply to HA staff members who work at HA venues, hospital authority venues. Starting from today, bureau heads will contact the URA or the housing society, that is organizations in their portfolio, to talk to them about arrangements to dovetail their work with that of the government. They would also need to require their staff members with sufficient notice to get vaccinated before they are allowed to return to work. At the moment, there is no plan to extend the application to shopping malls or private workplaces because the implications will be far-reaching. Like in overseas countries, it will in effect become a lockdown, that you are confined to your own home. But I cannot rule out the possibility of any changes in view of the changing epidemic situation. I can't tell you here that there are things that we would not do, of course, and we will not do anything that is illegal, but we need to keep in view the development of the pandemic as well as the advice of experts. The same goes for social distancing measures. In the past 2 years, the most difficult decisions have to be made by me. I know that there are drawbacks of these measures. They impact the lives of the business sector, general public, as well as people from other sectors. At the moment, we have no plans to tighten these measures because, as I said, that for those recent cases, we were able to trace them to imported cases. The few cases from Moon Palace were picked up under mandatory testing during the quarantine period. It's not the case that they were moving about unchecked in the community. So it gives us the assurance we need that the measures we have in place are effective. So far, that means as at today, we don't have any plans to tighten social distancing measures or to suspend classes. For the latter, we are aware of the impact on students. A number of educational psychologists have conducted research with their findings showing that class suspensions have a huge impact on students, especially grassroots students. We have to exercise extra care if we decide to suspend classes because of the sheer impact on students. Thirdly, the breaches of cafe staff members, I am very unsatisfied. That's why on the 31st of December, I met with the president and the CEO of Cathay Pacific and reprimanded them. They are of the highest echelon in the company. They may not know about everything their staff members do, but still they are accountable because they are the head, just like I am the head of the government. I hear that certain actions have been taken. If there is a legal basis, of course, in relation to the breaches, we would take action. But at the moment, there is no clear legal basis for us to take any action. But I'm not going to bound myself to any decision because we need to look into whether there is any legal basis to take legal action. But their behavior is extremely irresponsible. A couple of crew members have breached the rules, and as a result, 370 people had to spend their New Year at Penny's Bay, and a large number of people will have to get tested, and some of them will have to be subject to testing 6 more times at great cost. The social cost alone is huge, let alone the cost paid by the individuals, simply because of the gratification of an individual who went to bars and restaurants. So I must say that people who are subject to high risk must take responsibility, and they cannot just act simply because they want to, because society will have to pay the cost.
有兩個媒體啦。
You asked about the fact that 2 media outlets recently closed down their operation. These were the decisions of the respective media outlets, and you cannot associate these incidents with press freedom in Hong Kong. For one of the media outlets, we did not do anything. They were never approached by law enforcement agencies. But if they decided to cease operation out of their own concerns, I think this is nothing out of the ordinary in Hong Kong. The SAR government does not seek to crack down on press freedom. Instead, we play by the law and we respect the rule of law in Hong Kong. When I first assumed office, I opened up government press conferences to online news outlets, and I met the Hong Kong Journalists Association at that time. We wanted to facilitate reporting by online outlets, and the arrangement is still in force today. So the registration scheme is still in effect. So long as news outlets do not engage in illegal acts, they can continue to report news in Hong Kong. Since the implementation of the Hong Kong National Security Law, the number of registered media outlets went up. For local outlets, there was an increase of 5.4%. For overseas outlets, 9.5%, and the number of mainland news outlets registered actually declined. So you cannot say that the freedom of the press in Hong Kong is eroded due to the closure of 2 media outlets. This is our view. Next question.
Good morning, Mrs. Lam, Hong Kong Free Press. On COVID, figures are at an 8-month high. Will this affect plans to reopen the border? And experts have said that they're really struggling to find out, tracing people who've been at the restaurant in question. Will the Leave Home Safe app be upgraded as they've suggested? Second, last week, and on several other occasions, you denied there was a chilling effect over press freedom concerns. With Citizen News citing vague laws and staff safety as their reason to close, do you accept that this is a perfect example of a chilling effect? And third, you just mentioned meeting the HKJA. Would you be willing to meet them again to discuss some of these concerns? Thanks.
First of all, of course, the spread of Omicron variant into Hong Kong community is worrying because of the high transmissibility of this variant. That's why we have taken all the measures that we have put in place as a result of 2 years of experience in fighting COVID-19. But inevitably, with a local infection of Omicron, although the several cases now confirmed could all be traced back to an imported case according to the variant analysis, but that would certainly have an impact on the ongoing discussions with the mainland authorities on resuming some normal travel. So I will not deny that that has an impact, which means that we will have to wait another while before we could put in place this very sought-after resumption of normal travel between Hong Kong and the mainland. The second point is about the tracing. I heard some experts still commenting on the effectiveness of the Hong Kong's tracing system. But I would say that actually Hong Kong's tracing system, contact tracing system, was pretty effective. If you imagine with a restaurant with 64 tables of customers involving 207, within a few days we managed to trace 201 and managed to put them into a quarantine center for 21 days. That was a major achievement by the contact tracing office. And by the way, the contact tracing office already involves a lot of disciplinary colleagues. So I heard one person saying that, why don't you call the police? The police and other disciplinary colleagues are already deployed to the contact tracing office for quite some time. So I think that we have been very effective. And the Leave Home Safe have broken the record of giving notification to more than 30,000 people who may have patronized this restaurant and other places, and hence they have come forward for their compulsory testing in the last few days. But other than commending the efforts of my own colleagues, I would really want to take this occasion to express my deepest appreciation to the people of Hong Kong. Hong Kong would not have come that far in controlling COVID-19 without the full cooperation of our people. This high discipline of wearing a mask, this willingness to comply with RTD, that is restricted testing notice, or the CNT, the compulsory testing notice, and being put in a quarantine for 21 days through no fault of their own. So I really want to thank the people of Hong Kong, and they deserve to be recognized by all of us in fighting this epidemic. Now, about press freedom, there have been a lot of criticisms, especially from the Western media, about the closure of these two online media organizations. I could not, on behalf of these two organizations and the responsible people, to explain what do they mean by a chilling effect. But I certainly would strongly refute any allegation that this is related to the implementation of the national security law. If implementation of the national security law would undermine press freedom, then we will not be seeing any press freedom in the Western world. You name me, which Western country does not have national security law? They have national security legislation far more draconian than the Hong Kong national security law, which is very well defined. It covers offenses clearly defined, and we already have 3 convicted cases in court. So all these rules and bases have been clearly laid out. So I would really dispute that. And similarly, this morning I read news about because of the closure of online media, press freedom in Hong Kong faces extinction, or Hong Kong free press faces collapse. I just could not accept that sort of allegations. But nothing is more important than the rule of law in Hong Kong. And journalists and media organizations like all of us have to respect and comply with the law. If they are fearful of not being able to comply with the law, then they have to make up their mind and take the necessary decisions. Thank you.
Would you meet the JA?
I have no plan to meet it. I refer to the meeting when I took office. So I just want to say that when I took office, I've been as liberal as possible in engaging people from different parts of the political spectrum. But what has happened, and nobody could anticipate that actually Hong Kong was under that sort of very severe challenges with a lot of people advocating independence, colluding with foreign forces and undermining the power of the state as well as the Hong Kong SAR government.
今日一節最後一條，後排第二位男記者。
Final question of the day. Good morning. This is from TVB. There were some reports that the vaccine bubble was scheduled to be implemented by the end of this month, and now instead it will be implemented in February. Why don't you implement the bubble before Lunar New Year? Ahead of Lunar New Year, there could be a lot of meals and family gatherings, and with the threat of Omicron, would it be a better idea to implement the vaccine bubble before Lunar New Year? There were 5 Omicron cases in Hong Kong. Would this have an effect on the border reopening arrangement?
First of all, more stringent measures to boost vaccination is not just to tackle the transmission of Omicron cases. It is for a fighting chance to conquer the pandemic and for people's lives to return to normal in 2022, including opening Hong Kong to with mainland China and the rest of the world. So this is not just to tackle Omicron cases. What's imminent is to cut as soon as possible the possible transmission chain in the community. That's in relation to our enhanced work. The second point, to implement vaccine bubbles, that is, not allowing people who are not vaccinated to enter certain venues or participate in certain events. The number of people affected will be small, but still, we need to give time for premises to get prepared and for members of the public to get vaccinated. Otherwise, they would lose the chance to enter a venue. These are our considerations. I mentioned that in December, the CSB and the hospital authority announced that there will be vaccine bubbles for their staff members. Staff members have been given 8 weeks to get prepared, and this time round we give them 7 weeks, but the amount of work involved is far more complicated than the CSB and the hospital authority. We need to start our work without losing any time. There are technical issues raised by the sector. We hope to resolve these issues so that when we implement vaccine bubbles, it will be smoother. There are still over 1 million people who have yet to receive their first dose. We need to give them time. Well, if I announce that it's going to happen next week, you can imagine that there will be chaos in vaccination centers. Already we've seen queues, so we give sufficient time for members of the public to make preparations in order to meet the relevant requirements. Thank you.